Welcome. Thank you for joining Consumers Doc channel, Dr. Bengala, on the behalf of Foremost Organization. I would like to ask you a simple question. When you have checked out of the hospital, do they ever give you a bill for you to sign so you're responsible for the payment? You will never get a bill. I'll explain to you why. This is my focus, folks. This is what I've been talking about in healthcare. You will never see a bill when you have a study or imaging study or lab. They'll never tell you upfront how much this is going to cost you, how much the stay is, and how much the bill is going to be when you're discharged. This is the problem with our healthcare system, folks. That's why the cost keeps rising. You know why? A simple answer, folks. Simple answer. You're not in control. Consumers are not in control. Who's in control? Insurers. Insurers in control. They don't give a damn about the cost. Whereas consumers, they want to know the cost, because if they're responsible for the bill, they want to know upfront how much this is going to be my bill for today, visit, for this study, for this lab, this drug. They want to know upfront before they see the bill. That's the way our system works for us. Because consumer-driven healthcare is the way to go. Because we are wasting so much money on healthcare, folks. I'll tell you. Healthcare is a very chaotic system in the United States. They deliberately did so. They deliberately did do that. It is very simple, folks. It's very simple. Healthcare is when you receive the care for the services they provide you. That's called health care. Whereas health insurance is how you finance, how you pay for it. That's what it is. But they make it so complicated, man. Obamacare was a good idea, but it was insurer driven. There was no cost under control. I wish it was a consumer-driven Obamacare. I would like to see a consumer-driven healthcare system, folks. That's what is going to drive the cost down. Everything has to be transparent. You go to the grocery store, very first thing is you want to buy an apple. They'll give you a receipt. They'll give you a bill. Why not in healthcare? Come on, man. Why not? We should have a transparency in healthcare. It has to be affordable. It has to make sense for when consumer has to pay for it. Yes. But right now, the healthcare is all hidden. It's all hidden. It's not transparent. And this billing system has got to go, man. This billing system is costing 20 to 30% of the cost. And this middleman costing another 20%, so-called managed care, another 20% for the administrative costs. Same thing, billing, administrative costs, and the CPT course, DRG course, ICD-10, whatever they are all, that's for the birds, man. That's not the way it's supposed to be. It has to be transparent. When you get the care, you need to know the charge upfront, because consumers are responsible. Because when you introduce deductible health plan with health savings accounts, whatever the deductible portion, consumers are responsible. They're in charge. They need to know. The days have come where consumers want to know how much is the bill going to be. even before they get into the hospital, even they before have a study done, even they see a doctor on telemed. Telehealth is a good thing. Technology is always a good thing for the consumer. I believe technology is going to empower the consumer. Be ready, folks. Technology is going to change the healthcare as we know it. If you like this idea, follow me. Follow the Consumer's Doc, Dr. Bengala, on the behalf of Foremost Organization. This is purely voluntary, folks. I have a passion for healthcare delivery in this country. We can do a better job at it. I'll see you in the next episode of Consumer's Doc. Goodbye and God bless.